We're three medical doctors, Dr. Niamh Lynch, I'm Dr. Moritz Rasnichiala and Dr. Darren O'Leary. We're also friends. We have a very active group chat and we'd like to share some of those thoughts with you. This is No Scrubs. Hello everyone, Kate Mead to another episode where the three of us have a discussion based on what's happening in our group chat. So the subject we're talking about today is all things hair. Hair growth, hair loss, hair colour, hair conditions that affect the scalp. We probably won't even have enough time to cover it all. There's just so much. It's a specialty all in itself. But we're going to hit maybe on the top questions that each of us are asked individually and as a group basis as well. So yeah, hair. It's a biggie. I don't even know how to open the intro beyond that, ladies, because everybody has an issue with hair, be it big or small. People are always complaining about a facet of their hair, be the hairstyle, the hair color, the hair growth, issues that affect our scalp, issues that affect, children, older people. It's all there.
Yeah. So
Can I kick off with a question?
You can.
So menopause hair, grey, obviously. So you have to make the decision whether you go grey or whether you continue to colour it, which costs a flipping fortune. So there's that side of it. That's the sort of emotional side, the sort of visible sign that you're aging is your hair changing colour to grey. And then I suppose the other thing is thinning of the hair, that plus the fact that I used to have really greasy hair, like I used to have to wash my hair, often because it was greasy, and now it's dry. So like the texture, everything has changed. So like, can you tell me as a menopausal woman, like, why is my hair going grey? Do you know why hair goes grey? Is there anything we can do to stop hair going grey? Is there anything we can do to stop our hair falling out? And is there anything that I can do to get my glossy mane back? Apart from wearing a wig.
what peri and postmenopausal hair thinning and hair loss. I mean, it could start really from your 30s, your hair is getting thinner, androgenetic alopecia. That's the hormonal hair loss. That's what women and men experience as we get older. It's one of the most common types of hair loss, androgenetic alopecia, and causes hair thinning, hair loss, and women will start to notice it from about their 30s. And then there's graying of the hair as well. The medical term for that is canities. And
I've
that's,
heard of it.
yeah,
How did I? We obviously didn't go to
most
the same med school.
it's mostly down to your genetics. Like, so for the vast majority of people, you will go gray when your mother or father went gray. Like, there are some reversible causes of grayness, like in extreme cases, like nutritional deficiencies and things like that. But those are rare. If there was an extreme vitamin D deficiency or something like that, they can be reversed. Gray hair can be reversed in those cases, but I think it's safe to say for the vast majority of people, you cannot reverse gray hair, and you just have to make that decision whether or not you're going to dye it or not. And hair texture does change when it goes gray as well. Not only does it lose its pigment, from the melanin. So there's two types of pigment, isn't there? There's eumelanin and pheomelanin, and they both decline until your hair has no pigment, and it changes the texture of your hair. Anyway, with all of that to say, like, there's lots you can do, and I think a lot of women think that they can't do anything, and they don't attend the doctor about it. I have a friend whose mom was suffering from this, and she has not sought any medical assistance whatsoever. There's so many things that you can do. Like, just that, even in terms of shampoos, like the best shampoos that you can use are a nizoral shampoo or a caffeine shampoo. Like, you can get the caffeine shampoo in like Dunn's and Tesco. It's called alopecia. So you can use those shampoos. Also using minoxidil or Regain. It's, you'd think it's call it Regain for men, but it's the same thing that women can take it as well. And that really helps with female pattern hair loss, this androgenetic alopecia. So those would be the first two things that I would tell anybody who presents to me with hair loss. I would also always check their bloods as well, checking like your iron, making sure you're not getting hair thinning, hair loss, or hair graying because of low iron or low vitamin D, low vitamin B12, or because of, like, say, a thyroid condition or something like that. And so just doing a baseline set of bloods just to make sure everything is normal. And then, starting with the nizoral shampoo, you can like, washing your hair as frequently as possible. Like once a day is actually it's good for your hair to like what to keep your scalp nice and clean.
I don't have the time for that, Darren. I'm like, look at this hair. Like, if I wash
No,
it,
yeah,
I'll
no,
have
of
nothing
course you
done.
can't.
But you have plenty of hair. You have plenty of hair. Literally, like I'm pretty sure I had a telogen effluvium last year, because and for those who don't know what that means like basically a big molt. Like my hair was coming out in clumps. Like there was, big handfuls of hair coming out of my head all at the same time, and
Yeah, it's scary.
my hair became really, really thin.
Because I have a lot of hair, but even me, I thinned out post baby. About 6 months after she was born, I remember messaging there, and oh my God, I'm losing all my hair. And she was like, "Now, are you taking your vitamin D?"
Yeah, yes.
Sorry, we interrupted
So
you there. No, you are right. I know the research is there to tell us to wash it every day. It actually is the best response, and people look at us sideways. But yeah, I know it is.
Oh yeah, and I mean, look, it's just one of those things of like knowing the stuff, but like just because we know it doesn't mean that we have to do it. Like we know sugar is bad for us. Am I going to eat sugar this evening for work? I am. Like it is what it is. But just sometimes knowing like this stuff could be helpful. And then the telogen effluvium, that's stress related hair loss. So, and that can happen, that can be psychological stress or physical stress. So, if you had a pneumonia 3 to 6 months ago, you might notice that you have, or viral illness, or like a lot of people notice hair loss after they got COVID, or psychological stress. You went through like, workplace bullying or something, you actually might see that your hair is thinning, you're getting hair loss or hair thinning, and that's called telogen effluvium. That's a really common type of hair loss as well. So those are probably the two most common types of hair loss I see. And that's the hair loss that women get is out postpartum telogen effluvium because it's such a big stress kind of demand on the body for 9 months. And what I always say to women who are experiencing postpartum hair loss, like it will come good. It'll get better again. You just need to, there you have it. Um, but it may not get back to where it used to be because you're older, because your hair is just going to get thinner as you get older for most people. Um, but yeah, telogen effluvium after you suffer physical or psychological stress is very, very common. And then watch out for medicines as well. A lot of medications can actually cause hair loss, like non-steroidal anti-inflammatories like ibuprofen or diphenine. Beta blockers can cause them, like they'd be typically used for like stress or blood pressure. Some supplements can cause it as well, like high doses of vitamin A or biotin can cause hair loss, and they're actually in a lot of hair loss supplements, but high doses of them can paradoxically cause hair loss. Um, and
I
then
find that as well that people mention as well there in these days is, they say I went on Ozempic or they mention other GLP-1 inhibitor and they say, and it made my hair fall out. And what I tell them, it's not so much that medication made your hair fall out, it's just, again, the stress factor. If your body loses a lot of weight over a short period of time, potentially, and also potentially if you're not, if you're vitamin or mineral or supplement deficient with maybe eating less than you're used to, you could potentially also have that stress factor too of losing hair.
Well, I went on Ozempic, so there you go.
Potentially, but it might have had nothing to do with it. It could have just been,
No, I
menopause,
don't think it was actually because it had started. It had started
Mm.
before I started the meds. So I think whatever had triggered it was already in process
Yeah.
by the time I started on the meds, because it's growing back now. Like I have these ridiculous baby hairs that just look
I
like,
know the halo. Like I
yeah.
remember being at a hairdresser last year. I was doing a day's work for TG Carr and I went for a blow dry and I had the little halo. And I remember the poor hairdresser, he was there. He got the world's tiniest GHD. I'd never seen it. And he was there trying to calm them. And he was like, I'm doing my best here. I was like, I know. And like I spent 6 months on TV with a camera, and anytime there's any kind of moisture in the air, having that halo effect. So eventually I began just tying it in a ponytail and slicking it back because those baby hairs, and they're coarser as well, and they're a different shape to your own hair. It's I mean, my baby's just turned 2 now, and it's really kind of one of the last few months that I feel like my hair is under control. And I'm aware by saying this, I'm very lucky that I started off with a massive full head of hair. And it would be very stressful if you were somebody who was already on the pin side and then you lost it. So I mean, it has to be so distressing.
Yeah, yeah.
it's so like for people to say if we have, very dramatic hair loss and it's getting worse and worse and worse and people are seeing bald patches, or, very dramatically receding hairline, like they can't be, underestimated the psychological impact of that. And, people avoid going out, they avoid seeing friends, they don't want to go to work. It is so hugely upsetting. It's not just, a cosmetic thing. And, it's interesting, people who are on chemotherapy, they often experience hair loss as well. And oftentimes, it's they might, is my hair going to fall out? Would be the first question that a cancer patient might ask about a treatment. So your hair is it's not a vanity thing. It can just be so deeply psychologically upsetting to
Yeah.
lose your hair.
It's
So,
part of your identity.
or you just feel like so not yourself. I suppose when you look back in the mirror and you don't recognize what you see, that can be really jarring.
Mm.
Um,
It's very hard for men, I think, because it's
mm,
kind of like it's such a lottery whether they're going to go bald or not. And do you see people for that, MT?
Literally, my second last patient before we started recording this today was a gentleman who'd come in for hair loss, and they're coming more and more because, like you said, it's a big facet of your personality. If you identify with your hair, I know there are some men out there who do not care, and that works for them great. Same as like we had this discussion before about anti-wrinkle injections and things. You do you, but if it bothers you, it's great now that we have options for it, and I think men of today's life are better at coming and asking for help. So I actually just so happened I had, and I'd probably have, and it's increasing week on week. At the moment, I'd probably out of maybe 3 consults a week now with men. Sometimes I can help, sometimes I can't. But I think it's great that they're asking for help. And what I hope that even on the days that I can't help, that I can signpost and I can say, maybe go and speak to this person. Sometimes you're thinking, Jesus, there no more than a woman? Is there a medical condition beneath all this? The man who been in today actually had a hair transplant in 2020. He'd had it in Turkey. He went, got it done. He was very happy with it. And he noticed actually in recent months again, it was beginning to thin. And that's the thing to say about transplants. They work, but like your hair is like your skin, it continually regenerates. It's like if you got a facelift 20 years ago, if you don't do anything else, you'll need another facelift in 20 years' time. Age and gravity and rejuvenation, regeneration, and skin cell growth. We kind of forget that our hair is an extension of our skin and our scalp. And people often, their first port of call is to go to maybe a hairdresser. And while they have an absolute wealth of knowledge, sometimes actually what you need is medical intervention, be it with a doctor, a GP, or maybe very specialized with a dermatologist. So sometimes people are surprised when I say, actually, you should go to a dermatologist. I think there's something here that you need specialist intervention. But yeah, so men in particular, I don't know if they're not being told, if they're not being counseled appropriately, whatever, but a lot of them get a bit of a shock when they're told, when I ask them, are you on any meds? Are you doing anything to try and hold on to what you have? The transplant that you paid so much money for, and they're like, no. I said, well, yeah, we do need to keep supporting the hair because otherwise he will just return to baseline.
I when I lived in Canada, I knew a man who he wasn't bald, and he wasn't balding, but he was on medication to preserve his hair. What
Probably
would that have been?
finasteride, was it?
What's that?
Finasteride?
I don't know. Like obviously it's not a it's not a problem in the pediatric population, so I don't know.
I think some men do that if they know that they have a family history of male pattern hair loss and they don't want to go bald. So for some men, that would be so important. Now, I've never prescribed it in that scenario, but I have had one gentleman inquire about it, and he didn't want to accept the side effects. So it's finasteride or dutasteride are the medications that men can go on for hair loss, and some men, but you can't really take those if you're trying to conceive for men.
Yeah, so what are like how do they work? Are they hormones or
Are, if I recall, if I this is me guessing, but I haven't checked in a long time since medical school, but I think they reduced the DHT.
Yes, exactly. And
DHT?
it's the hormone dihydrotestosterone or something. I can't say it. I shouldn't be able to say it, but it's a DHT hormone. So basically, that is the hormone that kind of increases with age, and also it is the hormone that causes your hair to fall out. So that's why all the
Women as
dreading.
well.
Yeah, but especially in men, more so in men, but also in women. You're right, and that's why the joke came along. That man is bald. Oh, that's because he's full of testosterone. Basically, that's where the joke came from. So I think they initially, I could be wrong in this again. This could be one of those urban legends that we've just accepted as fact. But I think so. Finasteride, for example, is a medication with very common described in older men who have an enlarged prostate, and it might be affecting maybe their ability to go to the toilet. And then it was noticed when men were getting this dose that obviously their prostate was reducing, allowing them to leave it more freely, but that hair was beginning to regrow as well. Like all of a sudden, Jimmy, who had the big prostate, all of a sudden had new hair sprouting on his head. So that was kind of that tiptoed the research in that direction. So now the dose we give for hair loss, I mean, it is way, 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 way smaller than what you'd be giving somebody who's having issues with their urinary tract as an older gentleman, say in your 70s, 60s, 70s, 80s, maybe even 90s. And it's a tiny dose, but as Darren said, there is a side effect profile. So I go through that with the men when they come in, and I kind of really hammer home the point that there is a side effect profile, but it's very rare. Chances are it won't affect you. But you have to counsel them about it, obviously. The main one, obviously, is if you're very sensitive to finasteride, it might cause erectile dysfunction. It might cause a loss of libido. And then all the wives are like, give it to him. But like in general, it rarely happens. And when it does happen, we can reduce the dose again to the point where it doesn't happen. Or some lads decide, you know what, no, not for me.
And
there is
and
no
does it affect
evidence.
fertility as well?
That's what I was just going to say. There's no major evidence that it can affect your ability to conceive. But if you're trying to conceive, you would always remove it as a variable because there is evidence of potentially reducing a semen, I suppose, amount.
Yeah. Okay.
You know, because obviously your prostate isn't going full kilter.
Okay.
But in general, so basically, if you're trying to conceive, you take it out as a variable. Like you wouldn't leave it in there. It'd a bit like, you know, you wouldn't be drinking, you wouldn't be smoking. If you're, you know, you're not going to stay on the pill and try to have a baby. You know, you're going to take that out. So
Yeah.
the same thing for that. But interestingly as well, the advice is if you're pregnant to not handle finasteride tablets.
Well, so
The
don't even
broken
touch them.
tablets. Yeah, the broken tablets. Ideally, just stay away from them altogether. And then, interestingly, just before I forget as well, if there's anyone using Regain or minoxidil on their head, the topical version, don't let that near cats or dogs. Extremely toxic to them. There have been cases where the poor pooch, the family pooch, has died and gone to heaven because it slept in the same bed or maybe rooted about in the pillow. Extreme, not toxic to humans at all.
Sorry. Yeah,
Yeah.
and apparently particularly toxic to cats. I was just talking about my cat earlier, but like, I have Regain up in the bathroom, right, in the box, because I got it when I was having my whatever, my molt, and I actually didn't use it because I was worried about the cat.
Yeah.
So I would
It's a-
rather go bald than harm my cat.
It's a reasonable thing. Now you can get oral minoxidil as well, Niamh. Minoxidil actually was a tablet that was first created to help people deal with blood pressure, but then much better blood pressure tablets came along, basically.
And how does
So we,
the minoxidil work? What does that do?
as far as I'm aware, the way it works is that if you can imagine the blood capillaries in your head when you take minoxidil, the same way it works to reduce blood pressure, it opens them up slightly. And therefore, there's more vascular activity up in the scalp, therefore allowing for more hair growth, basically. Am I right there? And that's kind of the way I explain it to patients.
Yes. And it is important to say that oral minoxidil is the tablet version of Regain. Typically, though, that would typically be prescribed. Like a GP probably wouldn't prescribe that, but it is an option for women because finasteride is an oral medication for hair loss that only men can take. For women, the oral options are oral minoxidil, or spironolactone is another one. It's an anti-androgen. Again, was used to be used for blood pressure and heart failure, but has anti-androgen properties, so can be used for acne or hair loss. Now, some GPs might prescribe that for hair loss. And as well, Regain can be used on your eyebrows. Like a lot of women lose their eyebrows as they get older, and that can be quite upsetting. So you can actually put it on. There's a small little Regain kind of spray that you can get, and you can put it on kind of like to like an eyelash kind of spoolie thing.
Wand or whatever, like a mascara wand.
Put that onto your eyebrows as well. And what was the other thing I was gonna say? And the earlier you get in, the better. So, you know, if you see it, do something about it. Don't let it get worse. Like get moving on it, because people let it go and they let it go worse and worse and worse, and they don't appreciate that it's a medical condition that you can do something about, you know. Now, you know, you might, in terms of, you know, though, as I said, the most common ones are telogen effluvium and androgenetic alopecia. There can be, you know, like more specialist cases, like you would need to see a dermatologist for cases of, you know, alopecia, for example. And but seek medical attention. And, if you go to your GP about it, they will take you seriously. It's something that we are trained to deal with, or you might need onward referral. But the sooner you start treating it, the better.
Yeah, and actually, just a note on the oral minoxidil as well. Again, the fertility comes into from another point of view. If you're a woman, you cannot be on it if you are pregnant, breastfeeding, trying to conceive. It's not a medication that we want to be mixing in that scenario either. And the other thing for women to note as well, because it's mostly women that this would bother more so than men. If you're taking oral minoxidil and it's helping your hair grow, it won't just be the hair on your head that grows.
Mm.
You might all of a sudden find that like underarm hair, bikini line hair, leg hair also gets, a brand new sprouting as well. And some people would report that one of the side effects is that you can kind of retain fluid in around the ankles in particular. Now, some people won't have any of those side effects, and sometimes I wonder if I scare the BJ's out of people going through, geez, you mightn't be able to get it up. You can't get pregnant. You might kill your cat. They run out screaming. But like, I try to hammer that home so that they know and they're making an informed decision. Because I think if there was anything that kind of annoys me about this whole thing is that I've met a lot of men who have spent a lot of money getting hair reattached to their heads and have not been given any education at all to hold on to it, including medications and treatments. There are some people who don't want any medications and then they want the more intensive treatment. So that's where we look into PRP, polynucleotides, exosomes. And again, that's very individual depending on how they work and how much time and money and effort you're willing to put into it. But everyone's different. They all have their thresholds and things they're happy to do and not happy to do.
PRP, that's an important one for people to know about, isn't it? Platelet-rich plasma.
Mm.
Do you do that, MT, for hair loss?
I do. Interestingly, I always leave it as the last option. And the reason I leave it as the last option, so basically, say if you're a typical man, for example, you come in, you've got the typical male pattern baldness, and then usually I always say, look, medication is the lowest. I suppose we're not breaking the skin, so straight away that's the easiest thing for anyone to do: pop a tablet every day or rub a bit of foam on your head, and then we go into the treatment. So I kind of like to do a course of 3 of polynucleotides, exosomes, and then PRP. I leave PRP to the last because, well, as Darren discussed in a previous podcast, it's extremely messy. You're pulling blood out of somebody, you're thinning it, and then you're putting the plasma, injecting the plasma back into the area of concern. And then most of us aren't as healthy as we think we are. So the quality of your plasma is really only as good as healthy as you are. So if you're a 25-year-old footballer who hasn't had a drink since your 21st birthday, never smoked, eats very, very, cleanly, to use that phrase, and has looked after himself, yeah, his plasma is going to be great. If you're 40, 45, 50, just in general, the quality of your plasma is not going to be as good. Meanwhile, I open up a batch of polynucleotides made specifically for hair. I know this is amazing. It's been made in a factory. It has been made to a certain standard. So therefore, I know exactly what I'm injecting in. So what I found in general is, people's plasma varies greatly and then you get variable results. But if they're not responding to the other two, or if we just want to put the cherry on top, the plasma. But the plasma is great, but it depends on how fit and healthy the plasma donor is, so to speak. But it does work. And the beauty of the plasma as well is that, if you're anybody who's worried about autoimmune reactivity or just don't want to be putting anything foreign in your body, like, it's your own stuff. So it's
Yeah.
great. But in general, I try to leave it to the third for that exact reason. And it hurts. Well, it hurts more, I find, than the other two. So
Yeah.
kind of, especially with men, it's important to ladder them in. So I start off with the exosomes because that's just microneedling. It's just a small bit stingy. Polynucleotides into the scalp can be a bit ouchy. It depends how bald you are or how thin your hair is. And we can do all these for women as well, by the way. And then the PRP is more labor intensive, basically. And then you're into your hair transplants as well,
Mm. So,
which I don't do,
basically, what
obviously.
you're saying, MT, is if people, and it's more often men, so if they go to the trouble of going, say, to Turkey or whatever and getting a hair transplant, so you're taking healthy follicles from where the hair is. Let's say
Yeah,
they have male pattern, and
usually the
they're-
back of the head, at the
yeah,
nape of the neck.
but but basically the balding is going to continue. Like, it's not like they've reached peak baldness,
Mm.
so the hair loss can continue, and then
Yeah.
so then you're left with the little islands of hair that have
Yes.
been transplanted, but the pattern balding is continued, so the hair remains very thin, and it's just not in the typical male pattern baldness anymore because that's been disrupted by the transplant. So they need to maintain. It's as important, really, to maintain
Mm.
the hair that they have as it is to get the transplant. So that's
Absolutely.
just a kind of a quick fix, but you'd have to put the work in afterwards as well.
Exactly. What we're doing there is planting fresh grass into the lawn. But if we don't mow the lawn regularly and feed it with Miracle Grow, other patches are going to appear. Basically, that's it in a nutshell. So, and I feel like men in particular are not getting that messaging, and some of them, look, maybe they're being told and they're not absorbing it, yourself. And sometimes it can be very difficult when you're throwing a whole pile of information. You don't hear everything. And again, that's our fault though. I don't think that's the patient's fault that we're not giving the messaging. So it takes a bit of re-education, and they'll say, I had it, it didn't work. And you're like, well, sometimes it's just it didn't take. But if it did take and you had a fine head of hair for a year and then it begins to thin again, the issue is the undergrowth, so to speak, and the soil. Like hair is a living thing, and we need to keep that fertilized. And if we're not, it's going to fall out. So it's not like we have a certain amount of hair and once it falls out, that's it. The hormonal type of hair loss, if that hormone is in your system and if we're not managing that, or if we're not managing the growth factors in your scalp, and we're not opening up the hair the hair follicles to optimum level, this is where we have the issues then. You know what I mean? So like, they haven't been told, a lot of them, or the messaging hasn't absorbed. And again, I don't blame them. I blame us. We're not giving them the messaging properly. But they'll often look at, now, I don't know what happened to Wayne Rooney's head. Funnily enough, he's not in my patient profile. But they say, sure, he had a few hair transplants and none of them worked. I'd be interested to know, did he ever do the follow up?
Mm.
But he
Yeah.
has, I saw him on the TV the other day and I looked and I thought, actually, he does have quite a good head of hair.
No, but that would have been, I think that would have been goal number 3 or 4. He's infamous for having a
Right.
few transplants over the years.
Okay. So it's important to say it's all about hair transplants. Like you can get hair transplants as well in Ireland,
Yeah, you can't.
go to Turkey, like Hair Restoration Blackrock, is, a great place to go that if you want to go for a hair transplant or just even to discuss.
Consultation.
Yeah, it's a really good idea to get a consultation, because there's a lot more providers now in Ireland, and there's lots of different pricing ranges now. And depending on, this is where early intervention is key, because the sooner you go, the cheaper the hair transplant will be,
Yeah, because
because
there's less.
you need less to be done, and therefore then all of a sudden it's not as economically a good idea to go to Turkey. And we all know the risks of surgery abroad. That's not to disparage everyone working in Turkey, because I've seen lads in here who've had great results, but the worry is the follow-up, the complication. If there's any problems, who's going to look after you then? Less so but than the actual surgery, if you know what I mean. So
Yeah.
if you get in early, the prices in Ireland can be quite competitive too. So it's about finding somewhere. There's lots of different area. I can think of 3 places in Dublin just off the top of my head that give really good results, and the methods are getting better and quicker as well. So again, we use the garden lawn analogy. The less of the lawn we need to replant and reseed, the gardener is going to charge you less, but
Yeah.
like, you still have to keep it fertilized.
Okay.
Something that I experienced, as a GP, and one of the first line things that I would recommend for everybody with hair loss, is say if we've ruled out, a medical cause, ruled out a thyroid problem, ruled out a medication causing it, and so the best thing you can do now in the first instance is topical minoxidil or regain. No one wants to do it.
Yeah.
Do you have that? No one. People are like, you know, I have to apply a foam to my hair, every day. They don't want to do it. Now, I used topical minoxidil about 2 years ago. I had
Didn't you have something with your hair color? Was that? Did your hair have a weird color because you were using
it,
minoxidil?
it did. It did. So I was using the topical minoxidil, right? Because I had like a
You don't have cats, clearly.
yeah, yeah. I was using it because I had stress related hair loss and I saw some hair thinning. So I was like, right, I'll use my topical minoxidil. So I used it consistently for about 3 months. And because I would never ask a patient to do anything that I would not do myself. If I asked them to do something like go for a walk every day or like use minoxidil, like I would, you know what I mean? I think it's reasonable if you're suffering from hair loss, just get on board with putting the foam into your hair. And however, I woke up one morning, I put it into my hair as usual. I then went to go to get my highlights done. And when they took out the foil packages, my entire head of hair, which was a bright green like Shrek.
I would like to interrupt the story in a second.
Shrek is
where
gold.
I got she's
The
the
color
color,
or Shrek.
but I would like to interrupt before she continues the story, that if that was me, I would have gone insane and bananas and burnt the place down. I just get this really calm voice of, I'm just after getting my highlights out and my hair is green. We're going to have to fix this. And they stopped it.
I I was like, but you know what? At the time, I sent a text to Mark Rowe that day. I don't know if you know Mark Rowe. He's a GP in Waterford, and he's really good at like mindfulness and being calm, and he's just
You're
all about this.
grateful.
Exactly.
Grateful. At least I have hair to be green.
This is it. And I had been reading his book, and I was like, Mark, today my hair went green and I like didn't overreact. And he was like, well, there you go. The hairdresser dealt with it. It was fine. By the time I left the salon, I did not have green hair. But yeah, it was so green. And I was just like, right. Like everyone came over. But also I like my first son was really young at the time. I was so exhausted. I had no energy left to give to be stressed about this thing. And I was just like,
There are worse things in the world. But how did you figure out it was like, did the hairdresser freak out and think they'd done something wrong? Or how did you kind of figure out between you that it was the minoxidil?
I knew because I was like, "Oh, feck it, that had to have been it." It just clicked with me, and I said, "Damn it, I used minoxidil this morning. Like, what a stupid thing to do." So, like, don't put minoxidil in before going to the hairdresser. It's just such a stupid thing to do. But yeah, he sorted it out. He was very good. He also didn't overreact. We were all very surprisingly calm. We were all very
Yeah,
calm.
poor hairdresser opening up those foils, just expecting to see beautiful golden blonde tresses, and it's like green.
Like the greenest green, like bright green.
Did you take a photo?
No. Oh, I think I did, but I think I had to delete it. I was like, I don't this. I
I
don't.
was going to use it as the profile photo for this episode.
Yeah. No, I was just like, oh my God. Like I can't even cope anymore. It's like my blasted hair. Like, um, but yeah, that's my topical minoxidil story. A regan. But all of that to say, it's if you, it is very effective. Most people just my experience prescribing it is most people are just like,
It's
kind
hard
of
to
like,
comply. Like
yeah,
I remember I dated a guy years ago, who was balding, and he had his little sticking of whatever it is, regain. At the time though, well, he had hardly any hair, like God love him, but it wasn't a foam. He used to just kind of rub it on his head.
You
yeah,
get a
You know?
liquid version as well, I think. Yeah.
And that seemed a lot easier, but like that's a guy with short hair and he just has to do like that. Whereas if you're a woman or if you have long hair, it is a bit of a faff, I imagine.
the more
And
you do it, the more
yeah,
you
it just becomes part of your day.
like, and for most people, say like if you're just noticing the onset of like hair thinning, typically it's here at your temples, and you just massage it into the scalp.
So you don't have to do the whole scalp, or do you have to do the whole scalp?
You don't like for me when I had just had hair thinning up around here, it was like a telogen effluvium. I was just concentrating it here in the front. Because as with telogen effluvium as well, once the stress is gone, your hair will get better. And I was just noticing it more at the front. So I was just massaging it in here. And then you can wash it out after 20 minutes if you want as well, if you really hate the feeling of it. But it's less of a faff than you might imagine. Like I
Okay.
consistently for about 3 months just to get me through like that patch. And like, yeah, your hair isn't, shiny, or it might be less, like you, but it's still fine. It's doable. My experience is that I don't think anyone who I've ever prescribed it for has ever actually used it consistently for a few months. Everyone hates it.
Yeah,
Everybody hates
that's
it.
where you
And
have
and
I
do
have
you
a
have to
discussion
do you
with
have
them
to
about should you go oral?
yeah, do you have to
The
keep
closure.
using it then? Like if the hair grows back, do you have to keep on using it anyway, or
Depends on the cause of hair loss. So if it's telogen effluvium, that's a transient thing, like if the stress goes away, then the cause of the hair loss goes away, your hair will recover, then you can stop using it. However, if the cause of the hair loss, say is female or male pattern hair loss, like androgenetic alopecia, then yeah, you would have to use it. Like you would have to continue to take your cholesterol tablet to keep your cholesterol down. Like you'd have to keep, taking your blood pressure to keep your blood pressure down. I do, yeah, like if you had to use it every single day for the rest of your life, yeah, it's a faff, but
And actually, Darren, that's a good
effective.
point to ask you as well, because the next question I'm always asked is when I'm going through hair consults and skin consults with people in particular is, I go through all the medications they're taking, like you said, to see if there's anything there that potentially might be causing it, but also see if they're taking anything in an attempt to help it. And a lot of them are on specially formulated hair supplements.
The wildest thing about hair supplements is that they have high doses of things like biotin and vitamin A, and they can paradoxically cause hair loss. Like it's because it's actually it's terrible, you know. So I would say don't take a hair, skin, and nail supplement without talking to somebody who knows what they're doing when it comes to hair loss, because biotin is it's very commonly put into hair supplements, and that can cause a lot of trouble in terms of it can disrupt blood test results, it can disrupt like your thyroid function results, it can disrupt heart attack test results, and it can actually cause hair loss in high doses, and it's often included in high doses.
Acne? And what?
Acne, it can cause acne, yeah. And it there's not a lot of evidence that it can help with hair loss. And then vitamin A is another one that's included in hair, skin, and nail supplements, and that can paradoxically cause um hair loss in high doses as well. So, you know, you need, because I think a lot of people, if they're experiencing hair loss, will go for a hair loss supplement, and, you know, maybe I'll take two or three of them, and, you know, the higher dose, the better. And that's not necessarily always the case. To just be very careful with that about what you're taking and why you're taking it for hair loss.
Hmm. So that's hair loss covered. Very depressing. I mean,
No,
not depressing, but you know,
I think it's great. We've got so many different options that we can try. It's just
yeah, I
yeah,
think it's
it's just
just when it happens, because it's happened, I think, to all of us. Actually, all three of us have had it, like hair thinning. Um, Honestly, like it really stressed me out when it was happening
I
because
was I was very upset.
yeah, yeah, and you think, oh, look, I just really feel for men, I have to say, because it's always there, it always might happen, you know, and I think to have to live with that, I don't know, maybe there's probably a lot of men who don't really care, but I think a lot of men really do care
They
about it.
do. I think they do. They do.
Yeah,
Do
and you know
but
that's the thing. It's great if they care that we can now do something about it, and if
yeah,
they don't care, isn't it great too? I mean, I wish I had the self-esteem and the self-confidence to not care if I lost all the hair on my head, but I would really
yeah,
care.
yeah,
I think like the vast majority of people will care, particularly women. And you know, I suppose it's just really important for people to know like that there are so many options out there. Like you know, and to you were talking about microneedling. This is another thing that you could do at home. Like there are home microneedling derma roller devices. They can help with hair loss as well. And using a derma roller microneedling device, you can get them like
And your
online.
favorite device in the world, before you go any further, the red light.
Red light helmet. And I use that. I think that's been the biggest thing that has helped my hair growth in the last. I've been using that for over a year now, and I use it like 4 times a week, and my hair has grown so much. Like
did you say you were taking out your extensions or so, or your,
yes, they're
yeah,
out.
yeah,
I think yes, I had extensions, and I really because I'm getting older now, and I my hair is getting older, and I just feel like my hair can't. I can't subject it to the weight of the extensions anymore, because it's not gonna tolerate it, so I took them out, um, and like, they were nice, like, but I just feel like as you get older, your hair isn't going to put up with the same abuse that it did when you were younger, you know? Yeah, but the red light helmet, like, it really helped my hair, and that works as well by reducing that DHT hormone that contributes to female and male pattern hair loss. Like, it's like, I remember at first when I was first talked to my husband, I showed him this thing, and I was like, "Look, here's the evidence. Here's this device. Like, can we get this?" And he was like, "The evidence is going to be really strong for it now with that price point. Like, it's really expensive." And I thought about it for ages, but like in terms of cost per wear, it's like one of the best things I've ever done. It's helped my hair so much, so much.
that's really interesting.
And
It's
it comes back
fascinating.
to again to finding the right one, doesn't it? And
Yeah,
doing your research. And sometimes a bit like skincare, sometimes while some you can get great results from the stuff that are cheap as chips, sometimes you need to go up the price point for the evidence base to work and for it
yeah,
to have the power that you need. Like this isn't buying a red light helmet off Amazon. Like you do have to do your research and find a decent one.
hmm, yeah.
And a lot of people have red light masks, and you could just, if you don't want to buy a red light helmet, you could just put the mask on your head. Now, you won't get as much coverage with that.
Will you end up with like a face shape on your head?
And you can pull strands out and highlight them green.
Yeah. Yeah.
Get the helmet, kids. Get the helmet.
Yeah.
Come here. So we have so many other things.
Like, oh my God, bald patches where the eyes should.
Yeah, yeah.
And then Darren's gone off now, panicking. She's going to check her helmet, make sure it's not going to leave any weird shapes on her head. Come here. We have so much more other things to talk about here. I think I want to come back to you now, Niamh. And what we were talking about hair loss and things we can do to help thinning hair and hair loss in men and women in different stages of life. You have a unique issue amongst the three of us that you often deal with hair carrying visitors.
Yes. So I was looking, you guys have the pleasure of having young children who have not yet entered public educational environments where I remember when my older girl came home for the first time with head lice. I swear to God, I just wanted to run out of the room screaming because
I'm already itching now.
and like the thing is, by the time you see them, the infestation is very well established.
Oh,
So like literally her head was crawling. You like,
Oh.
and and then you have to
switching you. Do you remember?
huh?
Do you remember what age she was?
5. Yeah.
So literally in Lean Virgo, starting off into the big world,
Yeah.
here you go, here's an infestation, bring it home to mommy.
Yeah. So so there are some steps you have to take. First of all, like you really should inform the school because and then you're kind of embarrassed because you're like the patient zero kind of thing, even though they probably got it in school anyway. And there are steps then that have to be taken. So look, it's an inevitability. There's a myth that boys don't get them, but they do.
No, I was so
Sorry.
sorry.
Yeah. But that they do. And basically
She's scratching my head. Oh my God.
I know. So the first thing you'll notice is the scratching of the head, right? So they'll be scratching their head and you're like, oh, that's cute. They're thinking, and they're like, they're not thinking. So that's the first thing you notice. You might notice them getting a bit cranky because they don't sleep as well because they're itchy. There are a lot of phrases in the English language that come from lice. So one of them is feeling lousy. So lousy is lousy. Okay. So because in the olden days the infestations could be so big that the child would become anemic. Because they were losing so much blood to the head lice, and then they would become tired and pale and lousy, right? So feeling lousy that's the origin of that word. And then obviously the other phrase we have is nitpicking. So, you have to like pick out all the nits and it's a laborious process. So you have to become nitpicky when you're a parent of a child with head lice. So you have to, first of all, you have to fine tooth comb to confirm that they have head lice. Then you need to get your treatment. So any of the treatments you get in the pharmacy. Now, they used to just try and poison the lice. That's how we would have been treated, with like basically a toxin that would knock them out and kill them. But now the treatment is a thing that desiccates them. It draws all the treatment you put on your head, pulls all the water out of the lice, and they just shrivel up like little prunes and they die. But the problem with that is it doesn't kill the eggs. So you still have to fine tooth comb and try and find the eggs and get rid of them. Then the really important step that a lot of people miss is you have to go back in 2 weeks later and do it again, because the life cycle is those eggs will hatch. Even if one male head louse hatches and one female, and it's disgusting, but if they meet in the middle of your head and make little babies,
Oh my
I mean, there's a
God.
whole ecosystem there. Then you're into the whole cycle again, right? So you have to go back. And the other thing you have to do is they can survive off the head. They can survive in hats, in helmets and things like that. So you have to make sure that all the hurling helmets are checked. You have to wash all the hats.
And how would you clean the helmets and the hats and stuff? Like, is there a specific way of cleaning them, or you can't
Just
throw a hurling helmet into the machine? Like,
Well, you'll break your washing machine if
yeah, exactly.
yeah, or the dishwasher. I don't know. No, it would melt. You have to just scrub it and check it and make
Okay.
sure that there's nothing there.
Or you can, I learned this with tip from a dermatologist, you can, things like that are very hard to wash. And it's the same thing for scabies. Like say if a child has a teddy bear and they don't want to put it through the wash or, or
Or
helmet.
freeze
Yeah. Well, you can put them into a black bag,
Mm.
seal it, and just leave it there for 72 hours and they will die in there. You have to seal it completely. Or the freezer is another one. Like
Yeah.
putting the teddy bear into the freezer, but like the hurling helmet, for example, if you put it into
Okay.
a black bag for 72 hours, you don't, because there are some things that you can't wash that are difficult to wash. So seal, if it's scabies or head lice, sealing it in a black bag for 72 hours can.
Yeah. Because
Okay.
it's like if they're not going to survive forever, like they need food. So if you've put it away and and they're sealed in, then they can't escape and find another head, right? But let's say you treat your child for head lice, okay? You go through the whole process, and then they've hurling on Saturday. They put their helmet on. There's one little critter in there. Off you go again.
Oh
So
my God.
you have to wash all the bedding, and you have to do that again. So once you go, like, and that's why people say, they're resistant to treatment, I can't get rid of them and all of that. It's not the actual moment of delousing your child's head that's causing the lice to come back. It's the fact that they've survived somewhere, or you haven't gone back in the second time, and removed the new hatchlings.
And can I ask a stupid question, Eve? Does head lice just prefer children's heads? Because a lot of times you will find that the child will have it, but the parents manage to avoid it. Or is it just as simple as the kids are just working together, they're sitting next to each other at desks, they're playing together, so therefore the lice can hop and hop and hop in a way they interact in a way that adults don't?
Yeah, that's a good question. I mean, I've read that they prefer women's hair because they don't like the testosterone in the blood of men when they're.
So men who take finasteride might be in trouble when it comes to head.
Yeah, yeah. And the other thing I've read is that the eggs don't adhere to the shaft of hair that is dyed. But I don't. That's kind of more like an urban myth. I have certainly gotten head lice from my kids.
Okay.
So, like as they're cuddling you and their head is up against your head, like, it does happen. So like generally what I would do is if one person had head lice in the house, we would all just treat ourselves, because inevitably you'd find one or two little buggers on your own head as well.
Just treat
Yeah.
everyone.
And the treatment, like, do you have to go to the pharmacy and get the treatment, or is there any at-home treatment you can use?
Well, you buy the treatment in the pharmacy, so that's where you buy it, and then you take it home and you do it there.
Yeah, I'm
But
sorry.
there
What I mean is, like, is there any? If you're just talking there, but if we just suffocate them, I'm just thinking if I rolled my head in olive oil, would that suffocate them?
So basically, like we've had,
Be
like I
messy.
remember when I worked in Temple Street, which would be there would have been at the time, like this was in the early noughties, like inner city Dublin, like pretty deprived socioeconomic area. There were children who were admitted to hospital because of head lice infestations because their parents just could not get on top of it, and they were living in not great accommodation, and it was just really proving impossible for them to get on top of it, and they would be admitted. And I remember the first time, like I was a pediatric SHO, was my first P's rotation, and I walked onto, there's a ward called top flat, and I said, God, it smells like a chipper up here. And all the nurse was like, oh, the innocent Cork girl, haha, like, little. And I was like, I can smell mayonnaise. And they were like, yeah. So there was a ward of children who had had mayonnaise applied to their heads to suffocate, and then with little shower caps on. So this was the treatment. They were admitted for a week, and they were getting the mayonnaise applied, shower cap on, sit there, repeat, rinse and repeat, literally. And that treatment is effective, but it's very messy. And so some people do use that as a last resort, and there are professional operations that will do it for you as well. So like if you're getting into this cycle where you just cannot conquer them, then there are professional people who will come in and sort it out.
It's all ahead of us there.
Yeah.
I know.
Yeah. The joys. It's just when you know what, look, just so you know, like there's not much apart from when I found the pinworms, that and the head lice were equally like, oh my God, you know, my child is contaminated. Like it is a very much a kind of a moment,
Yeah.
Yeah.
You could immediately just start feeling itchy. Whenever I would have patients with scabies or head lice, I just immediately want to just go home and just like douse and like clear immediately.
Yeah. Yeah.
Oh,
Not nice. But it's just it's life, it's life. And
yes. Well, it's actually a good point, Neve. Yeah, actually, like jokes aside, like, don't feel stigmatized or shamed or about any of these things. Huge stigma and shame around scabies. People hate when I diagnose them with scabies. They're like, it can't be, it has to be something else. How could it be? It can't, I'm clean. But scabies is very common, and there's a huge surge in it post-COVID actually as well. It's hugely common now.
yeah.
And And it's just one of those things, so same with, head lice. It is life. It's normal life. And these things happen, and don't feel shamed or stigmatized about it. Like, it's just, it's an infection, it's an infestation. Same way you get a cough or cold or flu.
Or bed bugs.
Yeah. Oh, God.
We've
Wouldn't
got
you
bed
love
bugs too.
if people were as embarrassed about coughs and colds and weren't sending kids like
Yes,
pictures
yes,
into creches or
yes.
breathing and laughing or like coughing directly in your face? Like, most people
Yes.
still cough with their hand, and you're like, but they wouldn't tell you if their child had head lice, and you're like, please just be.
That is, yeah, I actually wish there was a bit more stigma around, coughs, colds, and flus, upper respiratory tract infections, like that people would be like, not
I know.
wanting, not
Not wanting
about,
to spread them.
yeah,
Yeah.
people don't care. It's like,
Yeah.
See, we're sensitive to this at the moment because we both have toddlers, and like every second day there's a new infection in, and there's a new something that's going to keep us awake at night, or coughs, colds, and then they have it, and then they recover, and they're
then you
full
get
of
it.
beans, and then I get it, and my child has no sympathy for me.
this is the thing. Like, I mean, and just these coughs, colds, and flus, like they link.
Then, like when my child brings home head lice for future me, like it's this long lustrous red hair. Who's going to fine tooth comb me?
I know. You'll be all by yourself, fine tooth combing up in the bathroom.
Mayonnaising my.
The joys.
But it's a good point. Not to feel shame or stigma.
Don't. No. It just happens. Yeah. There's nothing to be embarrassed about, but it is a big inconvenience. It is a big inconvenience. So yeah.
So, I mean, look, I think if I really wanted anybody listening to this to have a take on in terms of hair loss, you know, like, you don't have to put up with it, because it is. I can think of two people, like, that are just being hugely affected by this, in my life at the moment, that I know of, and that are just so upset about it now. One person isn't seeking any help at all, and like, there is help available, and there are treatment options available to stop it. So, whether you're using Regain or Nizoral shampoo or Alpecian shampoo, or you want to do something like a red light helmet, or want to use like a microneedling device, or go to somebody like MT for exosomes or polynucleotides or PRP, or go to your GP as well to make sure that there isn't a thyroid problem or a nutritional deficiency. You know, it's seek help about it if it's bothering you.
And the other thing, I suppose, we talk about stigma a lot, or we seem to have talked about stigma a lot in a lot of our conversations, but I think there's an embarrassment factor for men, is there?
Yeah, there
Is
is,
he
and I think
interpret near?
yeah,
Yeah.
Yeah,
you're not supposed to care.
I
Yeah.
think I've only ever had one man attend me about hair loss as a GP. So, and maybe a handful of women, because people think that it's not something that doctors deal with. I think.
Yeah, it's very true. And I find by the time they come to somebody like us, they run the gauntlet of various online services, buying this supplement, that supplement, watching whatever influencer is selling online, going to a hairdresser, going to this hairdresser in another town over who they've heard has a cure for this or can fix it. And sometimes I think what these hairdressers may offer is they have like really good shampoos and products that give the appearance of, and that's something that's really important as well. Make sure you're using a shampoo that works for you, and you're getting advice from a hairdresser about how to style your hair, how to not add more stress to it. And they do have access to products and things that will help in that department, but that's not going to help the root cause. Just pardon the pun.
Haha, root cause.
And by the time they come to us, their pockets are empty, their hopes are dashed. They're just wondering, what the hell am I going to do now? And then again, you have to try and be very kind. I never want to like rain on anyone's parade. At the end of the day, they entered into lots of different treatments and ideas in good faith. And as I always say, I've not been a doctor for a lot longer in life than I have been a doctor. So I have been that person. I have bought ridiculous things over the years that had no evidence behind them and no proof, but somebody told me it was good. So yeah. So like, it's no judgment whatsoever. By the time they come to you, sometimes they're a bit embarrassed to even, they feel like, especially men are embarrassed as a whole to be seen to care about their appearance at all. Women are embarrassed. They feel like hair loss is only a man thing, and they're like embarrassed that as a woman they're losing their hair. So it's a different kind of level of embarrassment. So like, we see it all. And I was mentioned in a previous episode that we've done, people can look for it, the one about we do about aesthetic treatments and stuff. I have a higher percentage of men coming here, and I think the reason, compared to most clinics, even though I'm new, and I think the reason for that is because I do sports performance and stuff, and they know I work with male intercounty teams, and they know I work with men, so they know I'm familiar with them. They have that familiarity, and I think that may slightly lessen the embarrassment, and only slightly. But I think that's why. But Men are often embarrassed to be seen to be walking into an aesthetics clinic, but because this clinic here does sports performance and I can do things like, say, steroid injections into joints and things, therefore, if they bump into their mate when they leave, it's like, sure, just go in there again, some steroids, man. I think they have that security blanket. But I think younger men are getting better at it. The men now who are losing their hair, some people very early in life, or things like early 20s, the majority now, the lads who are in their 30s today are a lot more educated and a lot less embarrassed than even men in their 40s. I've noticed that. And I think the big kind of barrier at the moment is the menopausal woman. A lot of them would never dream of going to a doctor. They just think this is something I need to accept. And we can accept it, but that doesn't mean that we can't try and alleviate it as well.
Mm.
Yeah. Yeah. Good place to stop, I think. So
Actually,
don't wait.
Don't
Yeah.
wait.
Yeah.
sooner you get in, the better. HRT can help as well with female pattern hair loss associated with menopause as well, just to keep in mind.
Okay.
Absolutely. We hope you enjoyed this episode and please continue to be part of the conversation with us. Please subscribe to our podcast, No Scrubs.